Okay, so now we are at 1:20 our time here in Central Time Zone, and I have the pleasure of introducing to you Dr. Anita Girard. Is an experienced healthcare leader with a demonstrably successful history of working in the hospital and healthcare industry. Skilled in nursing management, evidence-based practice, patient advocacy, nursing education, mentoring new leaders, and driving quality clinical outcomes. Her significant experience is related to Lean, Lean, implementation, and ANCC magnet designation. She is actively engaged in local, state, national, and international communities to promote the nursing profession and improve the quality of healthcare. Dr. Girard is a strong business development professional with a doctorate in nursing practice, focused in executive leadership from the University of San Francisco. Dr. Girard currently is driving practice and professional development as the Vice President of Nursing at Cedars-Sinai Medical Center in Los Angeles and serving as the President for the American Nurses Association of California. Please join me in welcoming Dr. Girard.
Hello, everybody. Wow, what a great adventure today has been. And thank you, Dr. Hedges, for that wonderful introduction. Chris, I have to say I've been multitasking all day and now I have to take a look at that. It's good to see all your faces. I should have probably done this conversation before all the happier ones, because I actually wanted to kind of present a case study about how we really created a culture of innovation during a pandemic here at Cedars in Los Angeles County. And it's not that uplifting of a story, but it does give you some structure and some processes that worked. At the time when I accepted giving this talk, I was thinking about, is this third surge ever gonna end? And will I be talking about it and giving tips to people while we're still in the prolonged third surge, which is what we anticipated. And I'm happy to say, we only have 34 COVID patients in our 1,000-bed hospital right now. And we also have over 100 COVID recovered, which still means they're incredibly sick patients in our ICUs, and our ICUs are filled beyond capacity. But I'm thrilled to say 34. When we hit below 50, we were just so happy. We've been up to 50% of our population being COVID patients, and it has been an incredibly trying year. So let me share some things with you. Can you see my screen okay? Is it good? Yeah, good. I'll just click in here. So I just wanted to also acknowledge our Senior VP and Chief Nursing Executive Officer, Dr. David Marshall. He's been key in really helping us through this pandemic. And then Sarah Stepien, she's our Magnet Program Director, who really put all the materials together. We presented this presentation at the Magnet Conference, parts of it, and it was really well received. So that's why I wanted to bring it here. My objective today is just to really show you how we're a 6th magnet organization, or heading towards our 6th magnet designation. So I wanted to show you how you can use the magnet model of nursing excellence for really a structural empowerment of how to create a center of innovation during a pandemic. So just a little bit about Cedars. We're ranked 7th in the nation. We're a 5th magnet, as I said, designated hospital. We're Joint Commission stroke certified. They do the most heart transplants. It's just amazing. I came here a year ago from Stanford Healthcare up in Palo Alto, California, Northern California, and just coming to this, larger center and seeing all of the great transplantation that they do here is incredible, along with our nurses. And something that really helped us was that we're a regional treatment center for Ebola and special pathogens. So we actually had a special pathogen unit, which was critical to our COVID pandemic approach. This is just a little bit more bragging rights. We were magnet designated in 2000 and all the way to 2018. And we're hoping for our 6th one in August of 2020. We have over 3,000 clinical nurses here, 889 licensed beds, but I think as any other large academic medical center, we're using every hallway, every place, that nook and cranny that we can possibly put patients, we do right now. So thank goodness we had state waivers where we're allowed to do that. Something else that really helped our innovation here at Cedars is that 90% of our nurses are BSN or minimum requirement. And you can see the national average is 55, and then the magnet average is actually 75%. So that high level of education, along with the high level of certification, again, really laid a great foundation for the start of innovation. This is the magnet model. It's one of my favorite models. I've spoken on all over the world, but it basically is very simple. It's if you put transformational leadership in place at all levels of your organization in the nursing culture and with working with international colleagues, then you really create a structural empowerment. And I'll break that down for you a little bit further as we go along. And then that promotes exemplary professional practice, which is demonstrated across the organization. But then it leads to the cool part, which is new knowledge and innovation and improvements that you can gain from that to really improve the patient experience and the nursing experience. And hopefully in doing all that, you'll be taking on the bigger, broader issues of global issues of nursing and healthcare. With that, you need to have a vision, and here ours is excellence in human caring, every person, every time. I just love that that resonates with me and so many of the nurses. I actually hear them saying it. They actually know our nursing vision, which is incredible. And then part of a magnet journey is to develop a professional practice model. So this is just an example on the left-hand side of taking really that person, family, community, putting them square right in the middle of the circle, and then having the different elements around it that can support all that. The people, the inclusion, the courage, the advocacy. And we use Jean Watson's Human Caring Science as our nurse theorist here. So also bringing in that caritas, which helped a lot, like Chris was talking about, caring for self before you can care for others, which is incredibly important. And that's what we practice here. I'll show you some of that. We also work on our strategic plan. It's a magnet requirement. And so this year we're building in COVID-19 strategies into our strategic plan. But that's just an example I wanted to provide for you. Our initial response was amazing. We had seen our first patients in early January, and then we had our statewide stay-at-home mandate, like everyone's really aware of. And then the governor ordered the hospitals to develop our surge plans. And as I told you, we surged to like 1,200 beds at one point in time. The Mercy ship was a great site of hope for us. We ended up not using it at all, though, because they wanted COVID-free patients there, and we had the majority of our patients were COVID patients. So, but it was just a wonderful site of hope to be coming into the LA harbor. I wanted to share with you some of the statistics. This is from February 20th of this year. And as you can see, the three trends, again, we saw our first patient here in January, but in March, that first surge happened. And then you can see the dark blue line is the daily deaths, and the soft blue lines are the daily cases. And it's been interesting to me, that the death rate has stayed the same until this third surge, and the data is not complete on that, but the death toll and the death rate went up pretty substantially. But it was fascinating to see the number of cases. And again, when they were peaking up to being 14%, we were like, are we ever coming out of this one? We really anticipated this surge lasting much longer than it did. It's just frightening from the perspective. We're over in LA County alone, we're over 1 million cases, and we've had 18,000 deaths. So it's been very significant death toll on the county. This one is just a suspected versus confirmed, and I just liked how the graph depicted it a little bit more clearly. And this for us was the interesting piece of the number of ICU utilization and confirmed cases in the ICU. As I said, we had to surge up to 150. We have 108 ICU beds, and we surged up to 150. We shut down all of our surgical services and any procedural areas, and we used every single space for ICU patients. So we have an entire ICU tower with 8 floors to it, and we pushed all of those patients. Anyone who could go out, we used the premise that we needed to keep the COVID patients in a 4-walled room instead of pushing them out to the PACU areas or the curtained areas. We felt the PPE burden for the nurses was way too high to be there.
After she's done, given that, you know what you want to say.
Anita, I think you got muted.
Thanks. Everybody moved out into the PACUs with all the patients, and it was just interesting care model. We tried very much different care models for nursing. The first wave, we did a team nursing approach where we brought in the PCU nurses and the med surg nurses to really help out in the ICUs. But the nurses spoke and said the team model really wasn't that effective for them, because then they were required to care for, perhaps 4 ICU patients with ancillary help. So what we did instead is we went to a max of 3 ICU patients per nurse, with what they like to be called as resource nurses. So they still kept the original charting burden and everything else with the primary nurse, but the other nurses were there to help out. So it was just a clarifying model for them, but I thought it was interesting that they were like, no, we don't want to use team nursing. We actually want to use resource nurses to help us out. And they used a lot of spotters to be able to help them make sure that they weren't contaminating each other as they doffed and donned the PPE. So first I said I wanted to go over the tenets of Magnet, and I wanted to talk about transformational leadership. Transformational leadership in Magnet is really where you have the vision and influence and clinical knowledge and that strong expertise. You have transformational leaders at all levels of the organization. And I like the one that it says listening. I think that's the biggest piece, is where the leaders listen to the clinical point of care leaders and make changes that need to happen in the environment happen for them. Thanks, Sandy, for shaking your head. I know we worked together. Some of the things we did from a transformational leadership perspective here at Cedars was immediately create an incident command center. We have a daily command center that is open all the time for all of our transfers and everything else we do, but we needed one that could just come up quickly. We kept it open throughout the surge. It's really helpful to funnel all the issues and concerns through an incident command center. Even sometimes when we felt like we didn't still need it, we kept it open. And then, as I said, we canceled all of our elective procedures in surgical cases. And restricting visitors, that was seriously a tough one. We deliver 7,000 babies a year. So trying to restrict, in the first and second wave, we actually restricted even the primary caregiver for the mom. And the third one, we were finally able to keep that open so that the mom could have a primary caregiver and perhaps even a doula. And that's helped a lot. And then the obvious ones that the masking and social distancing. And I just wanted to show you just a little bit of the timeline, just to show you the busyness. It was incredibly every day doing something, figuring out something, so much confusion around what do we need to be doing? What PPE do we even need to be having? Where are we getting it from? And I really thank the greater powers that we got to have those, what I call minor first and second surges, because I think our whole entire system would have collapsed if we had had the third surge first. We were not at all prepared. We did not have ventilators. We did not have PPE, PAPRs. And now, it's just such a different environment to be caring for these patients now. When we have all the job aids, we have all the things for the nurses, we're so much more prepared. And now it's truly, we were talking about hazard pay the other day, and it's no longer a hazard pay issue. It's really, we're taking care of an infectious virus that we know a lot about, and we know how to protect ourselves with very simplistic things like masking and hand washing and proper PPE. These are just some of the task force that I wanted to share with you. We set up task force for everything, and it really helped a lot, particularly the human resources one around, we created the telecommuting policies, travel policies, basically stopping them. We were just talking this morning how much we miss travel. I wish I was with all of you guys. It's so much more fun to be in person. And we created a redeployment bank for all of our procedural areas and ORs that all the nurses, so we had about 300 nurses come from the procedural areas that were able to help out on the inpatient areas. And then the rest of, we have 14,000 employees, so everybody was coming in to help out us with vaccine banks, with drive-through testing, with everything possible that we could put people to work around. And we also had a surge planning task force, clinical planning and management task force, which was critical for all the different areas, especially like clinical documentation. When you're trying to move patients around and you need to move them in Epic as well, and cohorts of whole entire cohorts or units of your cardio, CHF patients need to move to a whole nother area, and you need to do different coding for them and everything. So that was really beneficial as well. But I think that besides logistics and supplies, obviously communications was just absolutely key. We communicated every single day. We had huddles every single day. We still do. Our media team got on it right away to help out with media. And it was a great time for nurses to be seen in the media. We have a Spanish speaking nurse who's very eloquent, and she got on Telemundo. She's now got on the Latino board because of all of the different media requests that she was had available to her. And so I was just so proud as being president of ANA California that we really got a presence in front of the media, and our media teams here at Cedars were just great in asking not always just a physician or the C-suite, but asking the clinical point of care clinicians and respiratory therapists to get on the news and really talk about their experience. So many touching stories. This I just wanted to show you a surge planning, trying to build out how many COVID beds are you going to have versus how many non-COVID beds. And this was just some of our challenges that we had, and I think everybody had, was that rapid onset of high case volume. Again, not as high as the third, so thank goodness for that. And more so though, the conflicting guidance that we got. It was just so hard in the beginning with all the CDC and LA County and the difference between the national and the county standards and what are you supposed to do each day. So we had an entire morning committee that would come together every day and look at all the different standards and which approach do we need to take on any specific day. And then, as I stated already, the PPE shortages that we had, our staff did so great in just changing. We ran out of Sandy wipes, so we moved to Virex, and they were able to use Virex instead of that. And they figured out isolation gowns to make permanent gowns instead of the tearaway gowns, so that we could wash them instead. And they worked with a designer to be able to do thumb loops so that it would hold securely. And then they changed it from a tie to Velcro, and just the nurses just constantly looked at every single thing as what do I need to do with this piece of equipment, this thing, this room, whatever you've given me, and created so much value with that. I love reading quotes from our nurses. They're so amazing. One of them, Melanie, she got sick and she came back to work after being off for 3 weeks. And she felt bad because she felt like she abandoned her coworkers. Talk about the trauma that we're all going to have faced and have gone through because of this. But then she came back, and I love her quote. And I tell my patients, you can do this. I was there, and now I'm right here. I know you can do it too. And she really felt like they needed to hear that. And we had many of our nurses that got community acquired COVID-19 and were off and sick. Very few, fortunately, needed the ICU care or hospitalization. So that was great to hear that piece of it. But we had a proning belly trial that we had everybody go home with little pillows that they would lay on and inspirometers, and did a proning trial, and really being able to keep them off their oxygen and keep them at home, and giving them an O2 stat monitor so they can stay out of the ED and not get even more sick there. And I loved Barbara, her quote, we worked for over 10 days with the patient in the ICU. He was losing the fight. His death was imminent. His son asked me to facilitate a phone call with his family, and I geared up in my protective equipment and I gathered his family, and I put the phone on speaker. They were praying to him in Hebrew, and they spoke of his strength and how much strength to them and how important it was. And they told him that they will carry that forward and always honor that. And in these moments, you realize life does cease in the body, but your legacy lives on through people. I thought that was so beautiful. I saw I don't know if any of you saw in the New York Times, the new documentary that came out, and they put cameras on 2 ICU nurses and watched, they have a 11-bay COVID ICU unit. And so they watched the patients from kind of the beginning to the end, and watched the care that the nurses have to do, and how the nurses have to turn all their phones and laptops or iPads and talk with the family and hold the phones for last rites for the patient. And I highly recommend watching it, but make sure you have a whole box of tissue. It was a tough watch, but so insightful and beautiful. I think everybody put up a tent, but we had our tents too. And it really did help separate those COVID and the non-COVID patients from each other, and really used as a waiting room a lot of times, just to keep the crowding down in the waiting room. So we still have our tents up like everybody else. I just wanted to share one of our admission clinically warranted pathways. I think everybody made their own. We should have, if we would have had more time, it would have been nice to consolidate more as organizations, but we had one for the high to moderate clinical suspicion. They got the standard COVID test. The low clinical suspicion got the rapid order test, and the no clinical suspicion still got a rapid order test. So we tested everybody that came through our doors. We tested all our moms and babies, and fortunately to have the drive-through where they could, for any procedure that did need to be done, they could go through the drive-through for their testing prior to coming for any emergency OR or procedure that they needed. And transformational leadership continues. Just, I thought they'd want me to put on my scrubs and jump in the care. And that's not what they wanted at all. They're like, just please come and round. We just love it when you round. So I rounded nonstop, day and night with Dr. Marshall. We both rounded. And I just found it fascinating that that was the need. We celebrated every possible thing we could. This was the opening up of one of the other areas for an ICU unit. And so they did the red ribbon and the ribbon cutting ceremony, and the rabbi was there to bless it, and just celebrating any small thing that you could. We just yesterday had a big celebration because we were able to move some of our ICUs back into the ICU tower. And so we had homecoming celebrations for them and had a big breakfast, and all of the CEO and the CNO and CNE, we all went and clapped and just again celebrating. So what else was I going to tell you about this one? I told you about the changing roles of the nurses and that there were spotters. We used a lot of travel nurses, and just bless their souls. They all came from all over the country to help us out, particularly over this third surge when we surged to 1,200 patients. We had hired like 100 travel nurses to show up like in 3 days. So basically a strike force, nursing task force coming in. But a lot of communication, a lot of emotional support. Last night we had a letting go ceremony on the South Plaza, where we literally had the oncoming shift and the offgoing shift. You had a white carnation. We had disappearing ink, and the disappearing, you write on the paper and then you put it in the water of a person that you've lost, or perhaps something that you just lost yourself, and just letting it go in the water, and it dissolves into the water. It's so beautiful. Our spiritual care services were there. And then we lit a candle for anyone that you had lost during COVID. So we just had this big, huge table, an area full of candles, and somebody did singing bowls and actually sang with them. It was just so beautiful, but there was just tons of tears. Another box of tissue. I've gone through many boxes of tissue. I think they're all so important though to have ceremonies. We did another one where we clapped on the way in when they were going in and out of work, because we're trying to, as the rest of you, trying to get out of the COVID fog. Like, how do we repair ourselves? How do we come through this? How do we find our new way, right? So again, more with transformational leadership, we had town halls, as I said. We did not just the CEO updates, but also nursing updates for the staff consistently. We had a pay protection program. Thankfully, Cedars is a very protected organization and was able to keep our employees pay protected. We had that great employee resource bank where hundreds of redeployed staff were able to come and help out. We put our staff up in the hotel next door, and they were able to stay there, and many of them did, to stay safe away from their families. It just soothed their soul to be able to not have to go home and feel like they were bringing the virus home with them. And that's still in place today. And then we did the screen like everybody else, and a lot of just self-care webinars and unit-based self-care activities. So the next one in the magnet tenants is structural empowerment. And that's really about what are you doing to give some structure so that the nurses are active in decision making. I think I shared that with you already, but we also have a really strong shared governance structure that helps out, where they have their voices be heard. So some of the things that we did to provide empowerment for the nurses was our clinical specialists and everybody got together on collaborative committees, so that the voices, again, of those frontline clinicians that were working in the field every day were able to say, no, that works, or no, the rapid testing isn't working for us, or they say this is happening, but it's not really happening. So bringing everybody together on a regular basis, a daily basis, really helped a lot. And then just more of our beautiful nurse educators. We have a whole team of hospital-wide educators, like many of you do, that stepped in and did rounds with their carts. They took all the job aids and they helped anybody who was coming new to the organization learn donning and doffing and how to spot other people. And they moved all of our educational materials to virtual materials. It was just really incredible. They put all their resources on the internet. I think that was super helpful. All the job aids were posted so you could just quickly go there and figure it out. And then they rounded on specific, they'd pull a job aid and round on that specific job aid for the week. And something else that hit us during COVID was the George Floyd, the riots and the racial injustice. We had, on top of COVID surge, there was a lot of demonstrations right outside the hospital. So we had to go on lockdown many days. But, it taught us and it made us stronger. And our hospitals were really committed to the public and to the homeless situation and to racism. So from that, we used some of the things that we already had in place, and it strengthened it even more to create. We have a chief diversity and inclusion officer that's been appointed, and we're working on our vision for diversity and inclusion. And that's going to be looking at everything from the caregivers to the educators to the patients and families, researchers, our community, and then even our vendor partners. So we really want to take a holistic approach to how are we looking at this and removing some of the barriers so that we can really create a diverse workforce that's inclusive. Some of the other things we did is for structural empowerment, took out a huge ad in the LA Times, and I love this quote too. There is a word for somebody who in the middle of a crisis steps up to the front lines, turns plans into action, puts comfort of others before their own, again and again, day after day, shift after shift, a nurse. So we thank them there. We had signs all over Los Angeles. We had signs all over our hospital because you can't say thank you enough. And then the really cool thing is we had beautiful nurseries donate to us, and the sculpture on the right-hand side there is, living garden sculpture that they donated. It's a nurse with a stethoscope and it says, "You rock." So she now lives in our healing gardens here at Cedars. It's beautiful. We had the first responders responding, and again, just wanted to hug them all, right? They're just so beautiful, the LAPD. And then we had the Thunderbirds also fly over. I think they flew over Chris's hospital too. they made all the circle in LA County. But it was great. We all got out onto the plaza and cheered and tried to stay socially distanced. It was very difficult because we all wanted to hug each other. And then we didn't shut down Nurse Week. Again, another nursery gave us 1,000 flowers, and we just delivered them to all the nurses, even on the COVID units. And that's David, our CNE, they're trying to deliver into the COVID unit. But it helped so much, like the nurses really loved it. We were going to have them all just delivered, but then we went and hand delivered them all. And there was just, again, tears and so much gratitude for everything. We've had about 70,000 food meals delivered to the hospital. Our community has really such great outreach. That's just some of the other examples. There was bags of goodies coming every week from some other donor. It's just wonderful. So the third tenet of Magnet is exemplary professional practice. And that's really where you've created that great structure, and now you're going to bring forth the practice and the application of everything and strive towards new knowledge. One of our critical care educators, Lori Sheffield, she did a video on proning. She herself thought of it in the ICU right away. We said, "Have we tried proning these patients?" And so then she did some literature review and worked with the physician groups and did a whole module learning for proning patients without extubation or any issues, and got it posted on the AAC and the American Association of Critical Care Nurses resource. So we're so proud of her for that video, and now it's been published as well. And then our wound nurses were amazing in helping with pressure ulcer reduction, particularly with their proning patients. So they did a whole bunch of work around that. They've also been published on their work in that. And then they worked with the staff as well. None of our staff had any breakdown. The wound nurses circulated every single day, monitoring how they were masking and how they were doing with all of that. And then we also worked on a cardiac arrest during COVID. We used the Lucas device, which I had never used. I was new to that. So they brought the Lucas device in the room. It's that green device that you see up on the left-hand side there. And then they developed new protocols for how to respond to RRTs and codes so as not to have too many people in any one room. And you would think something as simple as windows and a door would not be a big thing, but our hospital was designed without any windows and doors. So we were burning through a bunch of PPE just to go in and say, "Do you want some water? What do you need?" And so we had a massive, the facilities took it on, and they put windows in every single door in the hospital. So it's been hugely transformational because now we can place COVID patients anywhere. So it's made it very beneficial. And as I said before, our nurses were pivotal in developing and creating the drive-through testing site. We do about 800 tests a day. We can vaccinate. Now they did the vaccination clinic in the mall, and they can do up to 3,000 a day. We're not getting the vaccine that we want, so we're doing about 1,000 a day, but we're really ready to take it on to around 3,000 a day. And the last tenet is new knowledge innovation and improvement, and that's where you're doing research and really looking into the design and implementation of clinical projects. So not just having input in the end, but really contributing to the research that's going on across the world. So these are just some fun things I wanted to add in. One of our nurses, she noticed that all of her colleagues were always touching their hair or their glasses or whatever, but in particular their hair when they were coming out of COVID rooms and contaminating themselves. And so she tried to look for a vendor to figure out if she could, purchase some for her colleagues, and found out they were expensive and hard to get and on delay. So she dug out her sewing machine and her sewing habits that she had, and she made these hats, which was just incredible. And then she took old scrubs and actually cut out the logo and put the logo on the hats, which was amazing. And then it went viral in the organization, and now people have all these crazy fun different hats, but it's kind of like the one bright thing in the day for people. This is one of our for our hearing impaired patients in the clinic in the cancer center. Ann Smith, she wanted to help out her patient, and so she took the vinyl window and worked with the hospital providing medical masks, and then she stitched in the clear windows and glued all the shuts and sanitized them with the UV light. And she made a whole bunch of them for this one particular patient, but our team has taken making them in real life more. But I just thought that was great innovation to handle in the moment. Our ED nurses took on the picture. We have a lot of pediatric patients, so it was so scary, coming up and seeing somebody with all the face guards and the pappers on and everything else. So they did the laminated picture on their uniforms, which they still wear on their COVID PPE. And they did great design things. They made clean and dirty in each unit. So the red zone is obviously the dirty zone, and the green zone is the clean zone. They made carts because we had to move away from Sani-Wipes, like I said, to Virex. So they made Virex carts, and they wiped down everything. They changed the gowns, like I told you about. So just looking at every single design of their work, they started writing on the windows like other people did because they'd seen it on the news. So they took that on and just continuously improving everything. When the state came out and said we had to go to face shields, and that cluttered up even one, we have like 200 workers on one unit. So the pile on the left is like the before the original design would just kind of throw everything together, and and then on the right, they actually took IV poles and reconfigured them, laminated everybody's names, made some great organized person put it all together, and it went viral across the organization. So now every unit has it really consistently. They can find their PPE and recycle. One of my favorite ones was they took the tubing from the IV pumps outside the doors, because you're having to make so many changes, and they were burning through again a lot of PPE and having to bring somebody else in all the time for all their double checks. So you can see with the red circle, they put the armband out on the IV pole outside the door. They had the armband on the patient, and then they actually used a Foley stat lock, which is for a Foley catheter, on the patient, and they put it around the rooms to hold the IV tubing. So I thought that was very creative. Our education department, I think, got the most innovative, though. You can see the number one is before COVID, when everybody didn't have to wear masks, and one of our new nurse residency cohorts, around 35 people. And then we moved to socially distanced classrooms and skill sets, and that's Dr. Marshall and myself welcoming in the new nurse residents. We like to do that every time they come. We host like 4 cohorts of around 30 new nurse residents every year. But then the exciting part was they evolved to virtual learning. So they put most of our health stream and everything else on the virtual classroom. But then they put a virtual skills room together, and we had donations for virtual reality goggles. And so they were able to take them home. And now they've developed a bunch of virtual reality modules around wound care and dressing changes and different things. So really innovative and creative. Our nursing research team has done some wonderful studies. They're involved in the nursing chorale study. They experimented with a Tazo device for blood collection. I don't know if any of you have seen that. I should put the device on here, but it basically is just a little pad that you can put on in 3 minutes. It withdraws the blood through a capillary. It just kind of sucks the blood into the device. And they compared it to drawing the antibody tests that way and through actual venipuncture, and found out that there was no difference. So this device is nice because you can send it home with patients. And then they contributed to 5 other nursing research studies around COVID, along with the physician groups, and also contributed to the literature. We just had study published on the multi-specialty nursing during COVID, the lessons learned. Just basically showing you at all tiers of nursing, you need to all be involved, engaged, and be innovating. So I want to leave you with a quote from one of our patients. She said, and I just love this, "I will never be able to adequately thank the caring, compassionate nurses who took care of my late husband as he lay dying of COVID-19 in the isolation in your hospital. The agony of not being there to be with him, to comfort and reassure him, was mitigated only by FaceTiming that my children, grandchildren, and I were able to do because of the time the nurses took to facilitate these precious moments with him. In the last hours of his life, we could see the nurses stroking his forehead and doing their best to soothe him." So profound. And so we wrote back to our nurses and said, "You did more than fight for this patient's life and more than provide him compassionate care in his final breath. You created a powerful human link for this family when they most wanted to be at their loved one's side and could not. The circumstances of this pandemic have called upon you to show extraordinary empathy and compassion. As you stand in for families in these last moments, you've accepted this duty with grace, and we're so incredibly proud of you." Just thank you, everybody on this whole session today. Thank you all for the contributions and good cheer, and just I love the EI one, the emotional intelligence one, and the paradigm shift and how to handle through crisis. And I've learned a lot today, and so I really thank you. And that's all I have.